All right, you know, it may be winter on the calendar, but here in Arizona, we wear shorts and dresses this time of year, right? Well, if you have varicose or spider veins, that can be really tough, but there is a fix out there. Dr. Paul Sauce of Optima Vein Care is here, and he's going to tell us what that is. Thanks so much for coming in.
Thanks for having me.
All right, I've been thinking about that. You know, it's already slowly starting to warm up. We had a little cold spell, but a lot of people wanting to wear shorts, but they have these veins. Let's talk about the difference between varicose veins and spider veins.
Well, the varicose veins, everybody knows what those are. Those big, bulging, ropey veins on the surface of the skin. And the spider veins are just little tiny varicose veins, in fact.
Yeah, we're looking at the varicose veins right now, and I mean, they can be really, intimidating to look at. It looks like, oh my goodness, what's going on? And then the spider veins also, you can have kind of little spider veins, but, you know, they can also almost form a bruise-like appearance.
You can have big, patchy surfaces with spider veins that burn, that hurt.
Now, what causes them?
Well, they both come from the same thing. They're the visible manifestation of an underlying problem that needs to be evaluated and treated appropriately.
All right. Now, what about, what you can do for them? Because you see these veins, you see we talked about the cause a little bit.
Sure.
What can you do for them?
Well, with a proper evaluation, you can basically treat them, and eliminate the symptoms that come along with them.
All right. And we're looking at some of the video. It kind of shows what happens and what would cause a vein. Well, when
the venous system in the legs doesn't do its job, pressure builds up in these veins and they stretch, they become visible, and they hurt.
Now, what about the symptoms? Like, you talk about the pain. That's obviously one of the symptoms, but there's more than that as far as, what to look for.
Well, there's things you can see. You can see these veins on your legs. You can see the spider veins. You can see swelling in your legs. You can see some skin changes. And then you feel a whole multiple symptoms. Basically, patients tell you that their legs ache, they're heavy, they throb. The more they're standing, the more they feel heavy, and they basically just want to go home and lift their legs up to get rid of that pain.
And are they common? Do a lot of people have this issue?
Well, our patients, we start seeing the females, in their early 30s, and by the time patients are in their 50s, about half of the patients have venous disease.
Wow, that's a lot
Very
of
frequent.
people. Now, I know, does this require surgery?
Well, we specialize in in-office procedures. Everything's done in-office. It's considered minimally invasive with basically no downtime. Okay,
now let's talk about Optima Vein and what you guys can do for people out there who are suffering right now.
Well, if you're suffering with this, or if you're having some of those symptoms that we've talked about, you definitely need to come in, because the whole evaluation of this and the treatments have become very simplified. We're at the point of all the newest treatments in this domain. You can come in, get rid of those veins. You don't have to be embarrassed by them. You don't have to, not wear shorts. You don't have to not go play golf, not go to the swimming pool, not go dancing, because you're embarrassed to have these visible veins on your legs. You don't have to suffer from those symptoms.
Yeah, it's a pretty simple thing to get rid of.
It's very simple now. Most people are unaware of the technology and the advances in this field.
Right. And I know a lot of people suffering, they think, if it was that easy, I'd get rid of them like that. And you're saying, yeah, it is
Come
nowadays.
in, we'll show you. You have basically an hour appointment. We can tell you what's going on and what the treatment plan would be.
Excellent. Now, are they covered by insurance, these treatments?
Most insurances have covered these types of treatments if they're creating symptoms and consequences in your daily life.
Excellent. Well, thanks so much for coming on. We appreciate it. For more information or to schedule a free screening to see how they can help, just go to OptimaVeinCare.com or call the number on your screen.